Myocardial infarction, commonly known as a heart attack, occurs when blood flow to a part of the heart is blocked for a long enough time that part of the heart muscle is damaged or dies. Symptoms of myocardial infarction include intense chest pain that may radiate to the arm or jaw, shortness of breath, and sudden overwhelming fatigue. In contrast, unstable angina is a condition that precedes a myocardial infarction, characterized by chest pain that occurs at rest, is unexpected, or is more severe and prolonged than previous angina episodes. Treatment for both conditions may involve medication, lifestyle changes, and possibly surgical interventions such as angioplasty or bypass surgery to restore blood flow to the heart. Risk factors for both conditions include high blood pressure, high cholesterol, smoking, diabetes, and a family history of heart disease. Here are detailed aspects of myocardial infarction and unstable angina, showcasing the parallels and distinctions between these two serious cardiac events. Pain characteristics, sudden and intense versus crescendo pattern. When differentiating between myocardial infarction (M) and unstable angina (UA), a critical aspect to consider is the nature of the chest pain experienced by the patient. In MI, the pain is typically sudden, severe, and may feel like a heavy pressure or squeezing sensation. It often persists for more than a few minutes and may not be relieved by rest or nitrates. On the other hand, UA presents as a crescendo pattern of chest discomfort. The episodes of pain increase in intensity, frequency, and duration over time. Unstable angina might temporarily subside with rest or nitroglycerin, but it is unpredictable and a warning sign that a heart attack could soon occur. Both conditions require immediate medical evaluation, though MI is often more life-threatening and necessitates rapid intervention to restore blood flow and minimize heart damage. Duration of symptoms, prolonged and persistent versus transitory and relapsing. Myocardial infarction, MI, and unstable angina are two conditions that fall under the umbrella of acute coronary syndrome, yet they diverge significantly when it comes to the duration of symptoms. MI typically presents with chest pain that is prolonged and persistent, often lasting longer than 20 minutes and not relieved by rest or nitroglycerin. This is indicative of actual death of heart muscle cells. Conversely, unstable angina features transitory and relapsing chest pain, generally lasting less than 20 minutes and often occurring at rest or with minimal exertion. Symptoms may temporarily subside with rest or medication, reflecting a reversible myocardial ischemia without cell death. Identifying these patterns is crucial for timely and appropriate treatment, which could include medication, lifestyle changes, or surgical interventions such as angioplasty or bypass surgery. EKG changes, abnormal Q waves and ST elevation versus ST depression or transient changes. In differentiating between myocardial infarction (MI) and unstable angina (UA), electrocardiogram (EKG) is a vital diagnostic tool. With MI, EKG predominantly shows abnormal Q waves and ST elevation, hallmark signs indicating that a portion of the heart muscle has suffered significant damage and necrosis. This pattern is a medical emergency, often necessitating immediate revascularization. In contrast, unstable angina presents with ST depression or transient EKG changes and does not usually result in permanent heart muscle damage. The absence of significant, persistent ST elevations or newly formed Q waves in unstable angina reflects ischemia without complete occlusion of a coronary artery. Understanding these differences is crucial for the timely and accurate management of acute coronary syndromes. Biomarker elevation. Cardiac enzymes present versus cardiac enzymes typically not elevated. Myocardial infarction, MI, and unstable angina, UA, are acute manifestations of coronary artery disease that can be challenging to differentiate clinically, yet they have distinct prognostic and therapeutic implications. The presence of cardiac biomarkers, such as troponin or creatine kinase MB, CKMB, is pivotal in distinguishing between the two. In MI, the occlusion of a coronary artery leads to myocardial necrosis, which releases these enzymes into the bloodstream, causing elevated levels that can be detected through laboratory tests. Conversely, in UA, the reduced blood flow to the heart is usually not sufficient to cause significant cell death, and as a result, cardiac enzymes typically remain within normal limits. Prompt differentiation is crucial. as MI often requires immediate intervention, including revascularization and anticoagulant therapy, while treatment for UA may focus on symptom relief and stabilization with medications and lifestyle adjustments. Response to nitroglycerin may not relieve pain versus often alleviates pain. Myocardial infarction, MI, commonly known as a heart attack, and unstable angina are two critical conditions that fall under the umbrella of acute coronary syndromes. Differentiating between them is vital due to their treatment variations. In MI, the blockage of coronary arteries is complete, leading to the death of cardiac tissue. Relief of chest pain with nitroglycerin is often incomplete or absent. Conversely, unstable angina involves partial blockage, which can cause reversible ischemia without tissue death. Nitroglycerin, which works by dilating blood vessels and reducing the heart's oxygen demand, often successfully alleviates pain in cases of unstable angina, making the response to this medication a telling diagnostic factor between the two conditions. However, relying solely on symptom relief can be misleading. Therefore, comprehensive clinical evaluation and diagnostic testing are crucial for accurate diagnosis and prompt treatment.